Yes, ma'am, I can hear you, ma'am.
Okay, okay. So this is a request, Dr. Soumya, to because the control is on your hand. So
Yes,
please mute everyone. Whosoever is speaking, only that person will be unmuted. Otherwise, keep everyone mute. Otherwise, it will be a disturbance and chaos. Okay. So that is a request.
okay, ma'am.
Okay.
Okay, ma'am.
Okay. Start, ma'am.
Shall we start now?
Yeah, we can.
Okay. Good afternoon to all the viewers. Myself, Dr. Akshata Pujar, first year PG scholar, Department of Prasuti Tantra and Street Yoga. Take this opportunity to welcome you all to the 11th live session of National Level Webinar Series Yoshita 2020, organized by PG Department of PTSR, SVM, AMC Ilkal. We are very grateful and delighted that we have with us today an eminent speaker, Dr. Anuradha Roy, who will be speaking on the topic Managing ANC and Labor during pandemic COVID-19. Now, I request Dr. Shobha Nadgoda ma'am to introduce our today's guest speaker.
Good afternoon, everybody. It's my pleasure to introduce such a great personality, Dr. Anuradha Roy. She is presently working in BHU as assistant professor in the Department of Prasuti Tantra in a faculty of Ayurveda, IMS, BHU. Previously, she worked as, she is ex-associate professor and HOD, Department of Prasuti Tantra and Street Yoga, and ex-dean, in charge College of Ayurveda, ex-medical superintendent in Northeastern Institute of Ayurveda and Homeopathy in Shillong, that is in Meghalaya. Madam has total clinical teaching experience of 13.5 years in UG and PG teaching experience of 9.5 years. And she has research experience of about 5 years. And she is also a PG research guide for 7 people. She is PG diploma supervisor or guide in maternal healthcare and research for 12 students. And also she is PhD co-supervisor for 1. She has a lengthy of academic achievements and honors. In the academic, she is the topper and gold medalist in BMS from Guwahati University, Guwahati. And in MS, she did it from Jamnagar University, and she was the departmental topper. And she did her PhD from BHU in the year 2013. She's handling many under her research projects, academic associate in Charaka Samhita online new edition project 1, and also member in Charaka Samhita online new edition project that is stage 2. Her research contribution is great. She did her research in effect of Dhatri Loha in different categories of female, that is adolescence, pregnancy, adult female, pre-menopause and menopause, form, that is ferrous, and quantity in the research contribution she has listed. And she has many books, chapters published, and she also co-edited Atulya Gotriya Adhyaya Charaka Samhita chapter 2. And she is also under her scientific books and publications, updating the and modification of PG diploma in maternal health care syllabus 2013. She is a great academician, and she is in the administrative also. Along with that, she has participated or presented with scientific papers in conferences numbering 2. She had many honors. I want to just list it out, read it out. We feel very proud, ma'am. You have so many honors with you. Just I'll read it out. Our students will be very much initiated by your medals, ma'am. Dr. Manjula Datta Chowdhury Memorial Trust Certificate of Merit 2000. Lieutenant Dr. Adyanath Sharma Memorial Award in year 2000, Dr. Sukumar Patel Memorial Gold Medal Award in 2001, KVJ Shambhunath Bhattacharya Memorial Award in 2001, Dabur Ayurveda Award in year 1997-98 and for the year 1998-99 and for the year 2000 and 2001, and Himalaya Jivaka Award for 2001, honors in Ashtanga Sangraha, Padartha Vijnana, Sharira Rachana and Sharira Kriya in first professional year VMS, honors in Rashastra and Vaishyaja Kalpana and Dravya Guna, Roga and Vikriti Vijnana, Agaratantra and Vyavahara Ayurveda in second professional year, and in third professional year, honors in Shalya Tantra. I feel very proud to announce all these, ma'am. And also, she is in the administrative field. Member, she is life member of Bharatiya Sannyahara Association, that is Association of Anesthetists of Indian Medicine. She is lifetime member of Vishwa Ayurveda Parishad. She is lifetime member of All India Ayurvedic Specialists. She is also in the Board of Studies as a member for BMS, BHMS under Northeastern Hill University, Shillong, Meghalaya. She is assistant editor in Journal of Ayurveda and Holistic Medicine. She is also in the editorial board of IUHOM, a peer-reviewed journal published from Northeastern Institute of Ayurveda and Homeopathy, Shillong. She also in International Journal of Ayurveda and Medical Sciences. And major academic contributions as guest lecturers and lecture and resource persons, number goes to 3, and she has 22 national and international publications, and she has worked in public awareness programs also, and the new model Vishishta Garbhini Paricharya by Department of Prasuti Tantra, Faculty of Ayurveda, IMS BHU, Varanasi, that is taken under her guidance. Various free health camps at remote villages of East Kashi Hills, Meghalaya. Rilang Orphan Home associated with Child Helpline, Shillong, Meghalaya. Field survey for the reproductive health in East Kashi Hills. And she is also an expert in ICMR project proposal, Reviver, and editor and member for the Journal of Ayurveda and Holistic Medicines and the International Journal of Ayurveda and Medical Sciences, IUHOM, and also Annals of Ayurvedic Medicine, etc. And her field of interest is very interesting. Various conditions of centric analysis of condition of ovary and infertility, aspects of reconstructional cause in relation to ovulation, changes and its effect on ovaries, designs and prescriptions in different categories of women with dysfunctions of ovaries. So, with this introduction, I welcome ma'am, and we feel very proud to have such a great speaker with us. I welcome ma'am and screen over to you, ma'am.
Thank you very much, Shobha ma'am. These were just the pieces of paper, but in true sense, I am just a learner in the field of Prasuti Tantra and Stri Rog. So very good afternoon and namaskar to all the participants and the viewers. So today, as Madam has elaborated so much for me, a very thank you from my side to you all, especially to Principal Sir, Das Sir, to the departmental faculty members, Shobha Madam, Satish Sir, Lakshmi Madam, and all your co-workers and research scholars. I am really privileged to be a part of this webinar series Yoshita 2020. So friends, today as we are going through this pandemic COVID-19, I thought that it will be a good platform to share some of my, views and guidelines which are till date prevailed from the various websites and WHO guidelines and other CDC guidelines, to share some of them with you so far as it is possible, because it's a vast, there is no ending to that, but I have tried to manage each and every point so that at least I can sensitize what exactly happening, and how to at least care for the basic things related to ANC and labor. So we start with the first, that is managing antenatal care and labor during pandemic COVID 2019. So to start with, the whole content has been divided into few chapters. The first, a very glance on the COVID-19, a quick recap. Then second, I will be highlighting on the categories of the females who are mostly affected by this COVID-19 pandemic. Thirdly, we will be discussing about the management of antenatal care. Next, we will be going through the labor management during this COVID era. After labor, we will be discussing about the breastfeeding in a COVID positive patient, what to do, what are the precautions, what has to be done, and what are the things has to be taken care of. A little bit I will try to highlight on telemedicine, which is very emergent and trendy nowadays. And lastly, as because I am a scholar of Ayurveda, I cannot present any presentation without Ayurveda. So I will be trying to give some hicks of Ayurveda Siddhant in relation to COVID-19. So to start with, the very first point which comes for everyone's mind, that why should I spare my precious 1 hour with anyone? So here is the answer. See friends, we have to hold and we have to trust and we have to live with the truth that we have pandemic COVID-19 and we have to bear with it. We have to stay with it maybe for lifelong. So that is the biggest truth that we have to accept, and that is a challenge. We have to take the challenge. Now, definitely there are some challenges related to antenatal care and labor. Now, we have to also be concerned regarding the healthcare workers, which are, daily working with the patients. We never know which of the patient are COVID positive and which are not. Also, we have to make sure for the safety concern of pregnant female, laboring females, their newborns, neonates, and their family members. We have to be concerned about that. Also, telemedicine is a new challenge. Also, we have to learn about telemedicine along with the legal aspect of telemedicine. And Ayurveda is a golden period now, but we have to scientifically validate all the data which are contributing nowadays and to make Ayurveda in the one of the mainstream healthcare services. So these are the few points I think is sufficient to snatch your 1 hour with me so that we can sensitize and have a look what's going on related to pregnancy and its outcome. So COVID-19 as a highlight, we all know is an exotic virus. We are never been encountered with such type of virus. And moreover, we are, very much new to this virus, and we have to have developed from zero the immunity for particularly this RNA virus. So this is very exotic for the whole population of the world. So that makes this virus to be very unique and different from others. So COVID-19 outbreak has placed the entire healthcare system into a crisis that it has to be changed, it has to be modified so that the entire healthcare system can have a faith on us in terms of safety concern and in terms of getting all the benefits which they are indeed needing of that. Now, a brief of COVID-19 as per the guidelines of WHO from the clinical management, which has been published on 27th May 2020, that coronavirus or the disease COVID-19 is caused by SARS-CoV-2, an emergent coronavirus, which was first recognized in Wuhan, China in December 2019. Genetically, it is a beta coronavirus, which is closely linked to SARS virus. Symptomatically, it can transmit from an infected to a other. So epidemiology and virological studies suggest that the transmission mainly is through the upper respiratory tract, especially the nose and throat, and with the droplets. Also, the clinical and the virological studies say that the incubation period of this virus, in average mostly is from 5th and 6th day, but on a range it's maybe from 2nd to 14th day. And this phase is termed as the pre-symptomatic phase, and which is very crucial because the person who is being infected and is in the stage of pre-symptomatic, they do not develop any symptoms, but they can transmit the virus to others. So this phase is very important and very crucial. And this droplet is the main, or even the bodily fluid can, can infect the others, maybe direct or in indirect way by contamination of the contact places and other for bites. So asymptomatic persons can also infect, rather the pre-symptomatic period is also vulnerable. They can also help, or they can also contribute in the transmission of the virus. The data shows, according to WHO, is mild to moderate patients who suffer from COVID-19 are having mild or moderate symptoms. Whereas 15% of the population who suffers from COVID-19, they required a supportive system, for example, the oxygen support system and others. Out of them, only 5% are critically ill and they require an emergency ICU management, and they land up to all respiratory, SARS and sepsis, and ultimately leading to the acute kidney and the cardiac injuries. So that is the fatal state of COVID-19. But the thing is that it is only the 5% of the total population of the COVID positive patient. Now, COVID-19 is a RNA virus, as we all know, and but the important thing is that it was detected until death, even the non-survivor, and one of the studies shows that this viral RNA was live in a patient with survivor even up to 37 days. So this makes this virus to be very special, that you never know that this live virus can stay in a live cell for how many days. Generally, we say it from the day of contact to up to 14 days, but you see it may extend even up to 37 days. So related to sign and symptoms of COVID-19, we always focus on the respiratory system symptoms, but the studies and the guidelines shows that it can even associated with the CNS sort of all symptoms, like starting from your neurological symptoms, delirium, encephalopathy, agitation, meningoencephalitis. Impaired sense of smell and taste is very important. We practically see also that patients do give a history. When we ask that whether there is any impairment of or any difference in the terms of smell and taste, they do give a history of this alteration. Then in many cases, you see there may not be any respiratory symptoms, rather there can be these neurological symptoms. So it is very important here in this point that remember that this COVID-19 can have even only the neurological symptoms. They may not have any respiratory symptoms. They may only land up with the neurological symptoms. So when we question or when we are sitting in a COVID OPD, it is very important that we should look for the neurological assessments also. Now, I have categorized the categories of female who are affected by this pandemic COVID-19 into these 4 categories, which I feel. The first category is the pregnant women, because just pregnant or continuing with pregnancy, both these groups are suffering because of they are not being able to have a physical consultation with their consultant. The second category of the female are under labor, active under labor patients, or who are anticipating their labor in the coming days. So they are the second vulnerable group. The third is the postnatal groups. Postnatal, if it is eventless, no problem, there is nothing. But if there is any comorbidity or if it is associated with maybe COVID-19, then again there is a question mark. The fourth category, which I have kept, is the menstruation. If it is an eventless, normal menstruation, nothing, no problem. But if it is again associated with any abnormality with the menstruation, menstrual cycle, maybe in any form, then again it is a difficulty for them to assess the medical help, as the physical consultation is again difficult in during this period. So these are the 4 categories of females who are mostly being affected by this pandemic COVID-19. Now, there is a guideline. This is the whole guideline from WHO. I have given the page number also. That what are the cares which has to be given to the COVID positive patients during and after the pregnancy. So they have given a guideline that as there is very limited data related to the clinical presentation for the maternal as well as the perinatal outcome for the COVID positive patients during and after the pregnancy. So on 24th April 2020, they have declared that on a single platform, there is no basic difference from this COVID positive pregnancy and neonate or the post pregnancy conditions as well as the neonate from the general population. This means that there is no basic difference between a COVID positive and a COVID negative patient. So almost they are broadly similar in general population. And one good thing from our point is that so far it has not been confirmed that there is mother to child transmission. Similarly, the evidence of increased adverse maternal or the neonatal outcome is uncertain. Limitation and limited, and the data are very limited for any showing transmission of infection in the 3rd trimester also. So this is good news for all the obstetrician that there is no chance for this transmission from mother to the child. Then, as because there is no, till now there is no evidence, so they have not identified the major risk or complications in the babies who are born from a COVID positive mother. So that is what WHO guidelines say. Now, coming to management of this antenatal care in this COVID era, there are some protocols. See, patients will be coming and patients are coming to us. It's not been written here that I am COVID positive or I am COVID negative. So the first thing is that all pregnant women with a history of contact with the person who is suspected or COVID positive should be carefully monitored. I repeat, it should be carefully monitored. They should not be neglected. Why? Because maybe this pregnant patient is asymptomatic, so we have to carefully monitor her. The second is that pregnancy or recent pregnant women with susceptible or suspicion or confirmed COVID-19 may not require any acute hospitalization or acute hospital care. When? Unless they they start deteriorating, they are unable to take food and even drink, and they are not approachable to nearby healthcare system or hospitals. Nearby, nothing is there. So in that condition only, they need to be hospitalized and taken a physical care. Otherwise, even if a pregnant woman is suspected or confirmed COVID positive, then also they do not require any acute hospital care. But again, in bracket, I just want to highlight one thing, that COVID positive patients has to be isolated and quarantine. Again, depends on state to state regulation, that whether they can be home quarantine or institutional quarantine or hospital quarantine. Here is again, in India we do have some sort of state wise regulation on that. So next is that counseling is very much important for all those COVID positive pregnant patients, that regarding what? Regarding all the pregnancy related complication which she may face. Also, all the sign and symptoms, including the COVID-19 danger signs. And the most important thing is about the decreased fetal movement or any alterations which she may feel from the normal pregnancy which she is undergoing. So that has to be taken care of. And also we have to counsel her regarding all the neurological signs and symptoms. If she is facing immediately an emergency condition, then she should visit a hospital, like blurring of vision, severe headache, convulsion, difficulty in breathing. All these sort of things has to be counseled well, so that she understand that when to come. The most important point for a pregnant woman and her family is a update. Like we need to update her for the preparedness of the labor, delivery, and complication. Like they should know that on the onset of labor pain or in any emergency, where to go and when to go. So these two questions, if it is solved, that when to go and where to go, then the complete counseling completes. So that has to be taken care of. And we do also do counseling for the normal patients also, but we have to take a little bit more precautions and all sort of counseling related to COVID-19 to those patient, pregnant females, as well as to their guardian or the family. Now, ANC recommendation as per the guideline is that in pregnant as well as in postnatal women, very important, two main mantras, they say. So two main mantras are, number one, that is self-isolation, and number two is self-care, where irrespectively whether she is positive or she is negative. So self-isolation and self-care intervention should be encouraged. Then a routine antenatal physical visit should be replaced by alternate platforms, maybe telemedicine, phone, over the other platforms like WhatsApp and other things. These are as per the ANC recommendation for the visits. Now, what about the abortion services? As abortion is an emergency services, it needs to be managed urgently. Now, as per the WHO guideline, it say that up to 12 weeks of gestational age, self-management can be done, but there is a condition. What are the conditions? The patient or the female to whom the abortion has to be done, she should be educated and she should be knowledgeable to that extent that she can manage herself first. And second, she should be approachable to some healthcare system, so that in odd hours of the time, maybe at night, midnight, if she will end up into profuse bleeding, she can go and the things can be managed. So if these two things are fulfilled, then a self-management medical abortion is can be done up to 12 weeks of gestation. And if not, then she needs to be have it in the hospital with a physical consultation. So this is all about the abortion services. Now, measures to prevent COVID-19 by a pregnant patient. This, though, we have to counsel for all patients, that these 5 things. And the main mantra, as I have already told, that is 2. That is self-isolation, self-care. You need have to isolate from the other, maybe in the home also. So self-isolation and self-care. These are the 2 main things which has to be encouraged always. And the remaining things we all know, that is home, hand, elbow, space, and face. So I'm not going to elaborate all these things. Now, OPD visits. The guidelines say that the limitation of the clinical visits, physical visit, should be restricted. And it has to be planned and organized in such a way that a pregnant woman, when coming for a physical consultation, at the same time, she go for her laboratory investigations, starting from blood parameters to ultrasound and everything done in the same, coming out from the home. So it can be done between 12 to 19 weeks for the first time. Second, maybe planned around 28 weeks. Third, 36 week, and lastly at term. But if there is emergency, it can be at any time, but following the triage. I will have a highlight on triage later in my slides. Then encourage always the virtual visits for the patients. And as far as possible, keep on counseling the patient regarding all the sort of, COVID protection measures which she can take by self. Now, if she is visiting a clinic or a hospital, health awareness and education is very important. So, visual alerts should be posted every here and there so that she can also be trained regarding that. OPD timing should be limited, and prior appointment should be given to individual patients so that a social distancing and other things, other protocols can be maintained. Then history, if possible, should be taken over the phone so that we can reduce the time of spent in the consultation room with the doctor. That will be beneficial for both the doctor as well as the patient. Then if possible, she can come alone, or if not, then only one attendant is allowed. And other precautions like shoe and hand washing and sanitization and other things has to be maintained. Face mask is to be is a compulsory. Thermal screening is always needed. Then do not allow or for any extra belongings of the patient or the attendant. That means we need to avoid all fomites to get into the entry. For us also, from the point of view of a patient also. So we need to prevent the fomites also. Now, these were all regarding the antenatal care or the antenatal visit which we need to do. Now, coming to delivery in the COVID period, how we need to deliver a patient, irrespectively whether she is positive or negative. Now, the OBG guidelines also say that all women have right to a safe and positive childbirth experience. That's true also, irrespectively whether she is positive or negative in status. So what we need to do is that first screening, evaluate all the pregnant women presenting in the hospital. So we need to screen for all signs and symptoms of COVID and related things before getting the patient admitted into the hospital. All thermal check and ask about whether where from she is residing, whether it is highly contaminated area, any travel history that has to be scrutinized and screened properly. Then second is that ensure that pregnant women and their attendant are not directly allowed to go into the labor unit or the labor room without screening or the workout. That has to be screened and workout and everything done. Then only admission and she enters into the labor unit. All pregnant women who are coming from high contaminated areas are taken to be COVID positive unless proven otherwise. Maintain distance at least 2 meters between the patient who is newly admitted and the others. Then we have to follow the SOP of triage. For example, if any pregnant lady getting admission, having a fever with respiratory rate more than 30 BPM, shortness of breath, cough SpO2, which is less than 93% on room temperature, heart rate more than 100 BPM, and also associated with altered level of consciousness, then she needs to be immediately get admitted into the ICU for the COVID suspected or confirmed case. So she needs a level 3 admission. So Once the woman is tested for positive, RT-PCR, then she should be referred to a COVID hospital where the L3 facilities are there, and that has to be very well managed. So every patient, or every pregnant woman should get into and should be screened and should be questioned well, so that at the first screening only we can have an idea that whether probability and the conformity of the COVID condition or the status, or from which zone we need the patient to be admitted. So if, for example, there is no sign and symptoms of COVID, then admit the patient in the labor room and deliver the patient, but it has to be in level 2 protection. If there are sign and symptoms, but it is mild to moderate, then isolation ward is needed, and it has to be under level 3 protection. Third category, if the woman is having SARI, then admit the patient in ICU with again level 3 protection. Now, very important thing when we segregate the pregnant women under labor, that which level we have to be get in, get admitted her, whether she needs level 1, level 2, or level 3 admission, has to be documented very well, because it's needed for future reference. So that documentation includes the whole name and other sort of personal information. So it's very much needed. But the very important thing is the total postal address and at least 2 contact details. So these 2 are very important to be noted down and documented. Now comes the induction of labor. There is no rationale to induce labor or deliver a woman early because only she is COVID positive. Preferably, it has to be normally delivered without any intervention, because it increases the risk of more and more, instrumentation and under anesthesia, and again, respiratory distress and other things. So it is preferable not to get any interventions done. And if also it is needed, it is preferable local anesthesia rather than the GA or the general anesthesia. Now, once admission is done into the isolation room for the labor pains has all started to a patient, then all sort of things has to be done. But my point here to discuss with you is that SARS-CoV-2 has not been detected in the vaginal secretions and amniotic fluid. So rupture of the membrane, till now, the data has no doubt that it's limited data, but according to WHO, there is no virus being detected in the vaginal secretions and the amniotic fluid. But then also we need to be have taken all sort of precautions from starting from face shields and everything. But it shows that it is not being detected till date as per the data says. Now, mode of delivery. See, according to guideline, COVID-19 itself is not an indication for induction of labor or, land up to a pregnant woman into cesarean delivery. It is not an indication for both. So it has to be without any intervention. But during the first stage, when the first stage of labor starts, what we need to do is that precautions. All sort of healthcare workers should have all sort of precautions, like depending on the level, whether it is level 1, level 2, or level 3. But PPE, basic PPEs should be there. Then continuous electronic monitoring should be done. If not possible, manually it should be done and recorded and should be documented. That is very important. And use of designated equipments like stethoscope and other things like pulse oximeters or multipara Dopplers. It has to be used whichever is designated for that particular place. Oxygen saturation monitoring is again an important point which has to be concerned and has to be written and documented. It should always be room temperature 94, more than 94%. Then the intake and output chart for the fluid is again very important to be mentioned, because overhydration or aggressive hydration may lend up to more pulmonary edema and may lend up to a very critical condition. As already the lady is under labor, she is in compromised condition, maybe an asymptomatic of COVID-19 also. So it has to be taken care of. Then second thing is that repeated unnecessary vaginal examination has to be avoided, so as to minimize the risk of exposure. No doubt it has not been detected till date, but we never know. Precaution is always better. So coming to second stage of labor, what precaution we need as a healthcare workers we need to do is that, say, in the second stage of labor, there is bearing down pain. And this COVID virus, or the this virus, how they spread, one of the ways is the aerosol. So while pushing down, the maximum aerosol release will be there. So the first thing we need to do is that ask the women to close the mouth and then to bear down, so as to minimize the level of aerosol. Second thing, stay away from her mouth side, face side. And third, if possible, get a barrier, a screen between the abdomen and the chest. And avoid unnecessary episiotomy and instrumentation. I already mentioned that it may lend up to unnecessary anesthesia and other things. So these are the precautions which we need to do in the second stage of labor. Third stage of labor, according to the guideline, is that we need to, prophylactically manage the PPH. So generally, we used to have oxytocin 10 units. So as per the guideline, it has to be doubled. So anyhow, the PPH prophylaxis has to be taken care of. Now, active management of third stage of labor in terms of neonatal resuscitation, it has to be at least 2 meters away from the delivery table, so that there is no chance of aerosol from the mother to the healthcare workers also, and even to the neonate also. Now, on remark, screening a birth companion is also very important, because only one birth companion is allowed, and that birth companion will be with the lady, or with the delivered lady or the woman afterwards, also taking care of the neonate as well as the mother also. So she should be screened properly. If found positive, then any other birth companion may be opted who is not positive, and she can take care of both the things. And then we give training for all basic PPE and masking and hand hygiene. So this is a general for the screening of birth attendant or the birth companion. Now, mode of delivery. What should be the mode of delivery? It is 100% individualized. It is the patient who will decide the mode of delivery. Now, WHO recommendation that induction of labor and cesarean section should not be undertaken because of this COVID-19 status. It should be strictly on medical basis, depending on the feto-maternal conditions, whether it is needed or it is not. So it is 100% depending on the condition as well as the woman's preference, what should be the mode of delivery. Now, again, there is a concept of delayed umbilical cord clamping. So according to guideline, it says that a minimum of 1 to 3 minutes of a stay back in the cord clamp will help the neonate for a betterment. And it is also seen that if we delay the cord clamp, the outweights of something which is very theoretical and unproven, that there will be exchange of this virus from the mother to the fetus via this umbilical cord. It is not been proven right now, and it's just a theoretical. So the benefits of waiting for at least 1 to 3 minutes is more relatively than not to. So it is better to wait for 1 to 3 minutes and then clamp the cord. Then comes your, the pregnant patient who has recovered from COVID-19. Okay, so they need a very normal antenatal checkup and antenatal care. They should receive a routine antenatal, postnatal, and post-abortal care as per the needs. So it need not have to be tagged that she was, COVID positive, and there should be some different protocols from the normal protocol. It's not like that. Once recovered, means she is into the common population of antenatal gathering. So she will also get the routine antenatal visits and antenatal management protocols as per the need of the pregnancy condition. Now, concluding remark is that all pregnant women receiving this should provide a proper counseling and information related to the potential risk of this adverse pregnancy outcome. So counseling plays a very important role, and proper information regarding the condition. Also, it is the right, also basic right for availing the sexual and reproductive health, irrespectively of the status, whether she is positive or whether she is negative, even up to the contraception and safe abortion. Then coming to breastfeeding. Now comes that whether breastfeeding has to be done in a COVID positive patient or not. So WHO has concluded that mothers should not be suspended from skin to skin contact and breastfeeding even after confirmation of COVID positive on mother side, because first the thing is that the infants are not vulnerable. Infants are not vulnerable for this COVID-19, and the risk of this serious morbidity of not breastfeeding is much higher than getting a breastfeeding. So breastfeeding has to be encouraged, and skin to skin contact is also to be encouraged even in the COVID positive mothers. This is as per the WHO guidelines. Now, postnatal management. In postnatal management, the routine protocol has to be followed. Nothing special, only good practice of the hygiene that is related to the purpurium and hand hygiene has to be encouraged, and healthy and nutritious diet has to be encouraged, just as to get infection free and immunity boosting. Now, discharge policy for a COVID patient, COVID positive woman who has delivered recently. So if she is asymptomatic, we can discharge her within 7 days or on day 7. If she is mild, very mild and pre-symptomatic, then we can discharge, or we discharge her on day 10th. But the condition is that the last 3 days of her discharge, she should be asymptomatic, as well as she should not have any fever. So then we can discharge her. So even after we discharge the COVID positive patient, she should have a home isolation for at least 7 days after the discharge. Now, this is PPE, that is all of us know, donning and doffing. This also, so many things are there, and the basic thing which I just want to emphasize is that maybe you use also during your routine practice. But one thing important is there, that during donning, when you put in, it should always be from down to up. And during doffing, that is taking it out, it should be always from up to down. That is the sequence. But as we wear 2 pairs of gloves, so first pair to be removed, and then it has to be done according to the sequence. So donning is from down to up, and doffing is from up to down. Now, when we are talking about all sort of antenatal visits in the OPDs and labor room management, so it is also very important to know that how to, biomedical waste management, how it is to be taken care of. So a separate color coding bins has to be there, and proper segregation of this waste has to be done. Very important point is that double layering, that is 2 bags has to be used or for all those waste which are coming from the isolation ward or from the COVID positive ward. And it has to be leveled boldly with a marker that COVID-19 waste. This is very important. And record has to be maintained for every COVID-19 ward waste, that how much and when and who has taken that out. Inner and outer surface of the container or the trolley which is being used for the management, waste management, it has to be disinfected with 1% sodium hypochlorite solution. Then our next thing is telemedicine. Friends, you all are aware telemedicine is a great trend and is in high momentum nowadays in current scenario, where it was initially a concept that those who are in remote areas, they cannot reach the hospital for fast and effectively, they are reached with the help of this telemedicine. But now this is being utilized as a basic and primary modality for the healthcare management. So telemedicine is now being encouraged for all sort of virtual consultation. So let's see some tips regarding telemedicine. It has been approved by MCI, and some pointers are there for the safe telemedicine practice, which I thought will be of your interest, that the same ethical and the professional standard has to be maintained even for if you are giving a telemedicine or a teleconsultation. Now, various forms of communication you may adopt. It can be video, it can be audio. So in video, it can be, WhatsApp, Zoom, Facebook Live, Skype, anything you can, according to you and your patient choice. Audio, it can be telephone, it can be voice message or any other thing. Even it can be a written communication by a media of messages or emails, and or even a piece of paper. So these are the various forms of communications which are being in trend nowadays. But for the safe telemedicine practice, the first consultation preferably should be in the form of video, so that you can have a rapport with your patient, and also in the same time you can have a look on your general condition of the patient to whom you are giving the prescription. So the first consultation preferably should be a video consultation. Now, there are some legal implications regarding the telemedicine, that on 25th of May 2020, the Board of Governors, they have published that legal implications should be there. Rather, the salient features of this are, it should be practiced by RMPs, and the doctor can choose the medium of teleconsultation, and minimum standard should be maintained for this teleconsultation. Responsible for the accuracy of the information, and the doctor can even charge the appropriate fees of teleconsultation, but they should provide a receipt of the bill which the doctor is charging against the consultation. Now, coming to our last point, so that is Ayurveda Siddhant. I'm not going in detail after this COVID session, just to give a few, research hicks from the point of Ayurveda, that see about Garbhini Paricharya, what has been mentioned in our classics, so nicely being detailed each and every concept. Sutikagar location, how to enter into the Sutikagar, what are the things to be there in the Sutikagar, what are the things to be done in the Sutikagar, who should be there, and all the protocols which were been mentioned since years and years, which has been quoted in our text, classical text. See the, the reason for a isolated Sutikagar, and also the beautiful concept which I feel may be one of the research hit during not only COVID, It can be for any other pandemic or viral infections or this sort of things. So why not to search our literature, the basic siddhantas which has been prevailed by acharyas, so as to get a best of the best maternal as well as the neonatal health. See the concept of dhupana as a rakshogna. So many things are there. 94 preparations are being mentioned in various classics in Ayurveda for the dhupana. So why not to get into an sort of the things that how it acts and what are the probable mode of action of this dhupana. Just to highlight a few. See, it cannot, it is a medical fumigation, and it is an advanced drug delivery system to the nasal route, and it has various advantages, including easy drug administration, higher bioavailability, high potential to penetrate the blood-brain barrier, and so many Dhupan, procedures and references are there in our classics. So we can have a sort of research on that. For example, I quote one example of this Dhupan Dravya. One of the commonest thing is Gugulu. So you see, Gugulu has been used for various combinations of Dhupan formulation. Volatile oil of Gugulu was found to be highly effective, and it has been published in this research journal that it has been found significant antibacterial activity against gram-positive bacteria and moderately active against gram-negative bacteria. So this is just an example. So such type of research and such type of studies, maybe multicentric studies may be undergone and can be encouraged, so that not only COVID has come, okay, it will stay with us and we will be used to with COVID, but nothing about COVID. But in future also, for healthy society also, we can think like that. And I complete my lecture with this, that it is our attitude at the beginning for any difficult task which will be affected by its successful outcome, and let us change our attitude and adopt the new practices. This is just an attitude. And I would like to share one thing. Just maybe in the morning today itself, I was just going through Facebook and I saw Kiran Bedi on Facebook Live, and I think I enjoyed it. So I thought that let me share this with you also. She told that COVID is an attitude, you see, and she has given a beautiful example. Most of us, we know also, there was a person, there was a master, he has given a task to two of his, marketing person, that go to certain country, किसी देश में जाना है और वहां जाके जूते बेचने हैं, have to sell the shoes. So the first marketing officer he go. So he went back and he told to his master that no one in that country wear a shoe, and how can I sell shoe? मैं जूते कैसे बेच सकता हूँ जहाँ पे कि उस देश में कोई जूता पहनता ही नहीं है. And on the same side, दूसरा बंदा पहुंचता है, and he was very surprised with the same thing कि no one wears a shoe. और वहीं से वो वापस नहीं आता, वो वहीं से फिर कॉल करता है अपने मास्टर को और कहता है सेंड मी ऑल एज फार एज पॉसिबल, जितने ट्रक आप भेज सकते हो आप मुझे जो है जूते भेजो. सो ही वाज वेरी सरप्राइज, बोले कि क्या हुआ. तो he told no, यहाँ कोई जूता नहीं पहनता. So it's a huge market for me. I can encourage people and I can sell all the shoes like anything. So the moral of the story is just an attitude which makes the difference. So that was Kiran Bedi live on Facebook, and I thought this is the good medium to share this, that COVID is also an attitude. It's our attitude how to handle. One COVID has come, it will go or it will stay. The time will come and say, but things will come. So it is only the attitude which makes the difference. So let's change our attitude and be happy and do something for Ayurveda, so that we can establish our system, and so that we can get into the mainstream of healthcare system. So with these few words, thank you very much once again to the whole organization, to the participants, to the listeners for listening me. I hope it was a little bit beneficial for all of you. So with these few words, thank you very much. Over to you, Shobha ma'am. Thank you.
Hello, ma'am. Thank you, ma'am. A very informative session. Our students still they are not exactly in the practicing field, so they have no queries. But they were very good listeners today. Very informative session for us, and you have made us to know the whole and soul about COVID-19 and its importance and management in our department. Thank you, ma'am. Dr. Jalian, sir?
Yes, madam.
Sir, over to you.
Thank you, ma'am. Thank you.
Good afternoon to all. So today's topic was very much need of the hour now, and madam conveyed all the things, whatever the precautions we have to take during the conduction of delivery or during the management of an antenatal care. So it will be maximum helpful for us, madam. Thank you very much for sharing your views and guiding us how to deal with the antenatal care and the delivery cases. Thank you very much, madam. It gives me immense pleasure to express my gratitude of thanks to the guest speaker of today's session, Dr. Anuradha Roy, madam, who is professor and HOD from professor from the BHU Ayurvedic Medical College, Varanasi. And on behalf of our management, principal sir, and our department, and on behalf of all delegates, we are so much thankful to you, madam. And we definitely wait for the positive things. When the corona is over, we definitely call you to our institute to deliver maximum topics and maximum knowledge with us. Thank you very much, madam. And also I would like...
Thank you very much once again, Dr. Satish. It was very nice interacting with you all, you Satish sir and Shobha madam and Lakshmi madam and all your participants. Thank you very much. It was indeed a real pleasure, and I will be very delighted to even physically be with you maybe sometime in recent coming days. So thank you very much.
Surely, madam. Thank you, madam. We definitely seek a positive response from you in future also. And I would like to extend our thanks to our beloved principal sir, management, for giving such opportunity or for creating such platform for discussion of such positive things, and which is a need of our also. And finally, I would like to extend my thanks to all delegates, all students who joined, PG scholars who joined for this session, for the success of this event. And also, I would like to extend my thanks finally to all our departmental staff, other departmental staff, and the technical person who positively involved in this session, and also our PG scholars. And if I left anyone, to all, I would like to extend my thanks. Thank you one and all.
Thank you.
So by this, we end the session. Thank you all.